Ladies and gentlemen, welcome to my presentation. My topic is Evaluation of a Brief Sexuality Education in a Nursing School in Hong Kong. I'm Dr. Hoi Nga Ng from Caritas Institute of Higher Education, Hong Kong, China. According to Maslow's hierarchy of needs, sexual need is at the bottom. However, sexual need is considered part of a higher order of needs. For instance, social need, self-esteem, and self-actualization is an important component of holistic health that affects quality of life. And there are also physical influence on sexual health. For instance, if we have cardiac dysfunction, spinal cord injury, or brain injury, these altered physical states may affect our sexual health. And of course, there are also medical conditions affecting sexual health, such as diabetes, hypertension, arthritis, and low back pain, etc. So all these kind of medical situation may affect our sexual function. So in fact, when we do have problems in sexuality or in sexual life, our quality of life may be affected. However, generally, we find that people may have some misconceptions. They might think that if we are sick or ill, probably people should not engage in sexual activities, or the sexual needs is not satisfied, and then our quality of life may be compromised. And also, we also find that patients are reluctant to express their sexual concerns because sexuality is a more matter of privacy and is still a taboo in the society. And there are some important roles of health professions to enhance our people's sexual health. So nurses may need to play a proactive role to address patients' sexual concerns. However, nurses feel uncomfortable, embarrassed, and unwilling to provide sexual health care. Probably the barrier for them to show their care for the patients regarding their sexual health might due to the inadequate of sexual knowledge, as well as their conservative sexual attitudes. So the objective of this study is to organize a sexuality education program to upgrade sex knowledge and foster a positive sexual attitude among nurses, the nursing students. The contents of the education program. The program consists of a 3-hour lecture and 2 sections of 2-hour group seminar presentations, and include tutorial discussions at the end of the section. The topic of education program include the following. First, perspective of love, theories of sexuality, human sexuality, sexual development, sexual function, impact of illness, and meaning of sexuality in all adults. Mode of instruction include lecture, group seminar presentation, tutorials, and discussion. We adopt 2 outcome measures. First, general sexual knowledge scale, and second, general sexual attitude scale. For the knowledge scale, we include 20 items. For instance, we have best sexual intercourse must have orgasm, true or false, and do not have orgasm, and orgasm will not get pregnant, and also children under 5 may masturbate. So questions like these will be designed. And the response format is true, false, and don't know, just 3 choices. Correct answer will score 1, wrong or don't know score 0. So the total score of this scale is 0 to 20. And for the general sexual attitude scale, we include, there are 13 items. Sexual intercourse without affection acceptable, and homosexual behavior acceptable, or petting immoral unless married. So these items are examples, and the response format is 4-point scale. 1 represents strongly disagree, and 4 represents strongly agree. The score of this scale is 13 to 52, and high score equals liberal attitude. And 32.5, scoring greater than 32.5 will be regarded as liberal, having liberal sexual attitude. Data collection. Outcome measures were administered at the beginning of the education program, time 1, and 2 weeks after completion of the program, is time 2. Participation was voluntary and anonymous. A pseudonym or 4-digit number was used for identification so that questionnaires complete at time 1 and time 2 can be matched. The outcome of sexuality education. Knowledge aspect. The results indicates that the average score of correct answer at time 1, so before introducing the education program, is 33%. And after the education program, at time 2, the correct answer, the total percentage is 91%. So that means there's a big increase of students' knowledge of sexual knowledge, their sexuality knowledge increased. So what about the passing rate? So if 70% correct is regarded as pass, so at time 1, 26.2% passed. But at time 2, after introduction of this program, 94.6% passed the sex knowledge scale. What about the attitude scale? At time 1, before the introduction of the education program, the mean score is 32.6, neutral. And at time 2, the mean score is 33.7, a little bit increase, become more positive. The conceptual midpoint is 32.5. The advocacy of sexuality education, we find that the results indicated that there is greater advocacy on knowledge than on attitudes. As you can see, the coherent effect size is 2.53 for the knowledge scale, and then 0.24 for the attitude scale. And we may find that there is this differential advocacy of these two scales. And then, of course, as we all know, knowledge is just unidimensional. It's about our cognitive component. And the attitude is multidimensional, including cognitive, affective, behavioral, etc. So we find for people, the introduction of this short education program, it is expected that the attitude might not change drastically. And we can see that the resistance to change is being observed. So attitude merges into a network of opinions, beliefs, and values that were interrelated. And attitudes were also embedded in a system of traditions, customs, and taboos, etc., especially on sexuality, right? So people might tend to prevent a certain kind of cognitive dissonance, and then the mechanism would be, well, just resist to make changes. And to conclude, we find that the advocacy, according to our finding, we find that the advocacy of the sexuality education in promoting sexual knowledge and positive attitude are empirically demonstrated with greater effect on knowledge than on attitudes. Implications. nursing students will feel more comfortable and confident in addressing the sexual concerns of patients, and quality sexual health care services will be promoted. Suggestions for future studies. Member of the education and comparison group was not randomly assigned because of administrative constraints. So in the future study, probably we need to have a randomized control trial designs. And also, this time two, the data is conducted towards the end of the semester, and then there's no follow-up arranged. So to allow time for the follow-up to assess the stability of the changes, it will be a better design in the future study, so that we can see whether this kind of changes can be maintained. And also, thirdly, participants are first-year unmarried students. Sample our students, right? And they are first year unmarried. So broader spectrum of characteristics to study the possible effects of socio-demographic characteristics, such as education, marital status, experience in clinical postings, etc. So if we can include these socio-demographic characteristics, probably the result can be different, and it will be more comprehensive to see how our nursing profession, their knowledge or their attitude towards sexuality can be reflected through the measurement of our scales. So these are our references. Thank you.